All right, video one for week one of clinicals. Welcome, everyone. If you're going through my clinical or someone else's clinical, here are some tips for you. Attend clinical on time and fully participate. Videos are on, all right? Or if you're in person, be ready to start to see patients. Do not refuse to see patients. Do not refuse to practice. If you're refusing, how are you going to be on your own? Remember to be ready with your stall prescriber guide, your DSM-5, and when you're done with clinicals, you add the Carlet MedFact book. All right. If you know the side effects of the medications, you'll know how to treat the patient. So, using the side effects of the medication, that's how you really treat the patient. All right. And also, based off of the symptoms is how you treat the patient, not based off the diagnosis. So, how the patient's presenting is how you treat the patient. Learn to listen. Know in mental health, the biggest part, the most valuable tool to ever have is actually having ears to listen. If you're doing your own thing, you're going to miss a whole entire diagnosis. All right? Get used to the DSM. Your certification, your boards, your school exams are based off of time. There's a difference between acute stress disorder versus PTSD. There's a difference between acute psychosis versus schizophrenia. There's a difference between bipolar 1 depression versus schizophrenia with depressive episodes. Get used to opening these manuals and books before you start on your own. The more you read now, the more confident you'll be when you're seeing a patient. All right? So when you come to me, you come to prepared, come ready. If you have questions, before you ask the questions, review your stall prescriber guide. In the bold under indications is FDA approved. Non-FDA approved are going to be not bolded, but you can still use it for prescribing. Know the mins and maxes of the doses of the medications. So, for example, Lexapro 5, 10, 15, 20. Above that, it's not even effective anymore. Please get used to it now so you don't have to be fumbling when you're on your own. All right? Same thing in clinicals. Don't ask me why you use Prozac for this. Look up in your stalls to see what's the indication of Prozac. I want you to learn to review these resources by yourself because physicians review their resources by themselves, PAs do, as well as NPs. All right. See you next week.